All right, let's talk about the most important rhythm in your life, your heartbeat. But what happens when that rhythm tries to send out a warning signal?
You know that feeling, right? That weird pressure or a flutter, maybe a quick pain in your chest? It's so easy to just brush it off. But that's your body trying to talk to you. And honestly, knowing how to translate that language, it's absolutely crucial.
So think of this as our little translation guide. We're going to figure out how to tell the difference between a simple little flutter and a serious warning sign. This is all about giving you the power to understand what your body is really trying to say. So let's get started.
Okay, first things first. We need a baseline. Like, what does a healthy heart even sound like? Well, it all boils down to that classic rhythm. You know the one, lub-dub.
And that sound? It's not just some poetic thing. It's actually super mechanical. It's literally the sound of 4 tiny but really powerful gates, your heart valves, snapping shut, one right after the other, in a perfect sequence. Doctors call these the S1 and S2 heart sounds.
So here's how that sequence works. First, you get the lub, that's S1. It happens when 2 of the valves, the mitral and tricuspid, snap shut. Then, right after, comes the dub, that's S2, when the other 2 valves, the aortic and pulmonic, close. Lub, dub. Lub, dub. It's so simple, but so powerful. I mean, it's literally the rhythm of life.
Okay, so that's the ideal. But what happens when that rhythm gets a little off? You know, when the engine of your body starts to sputter a bit. That's exactly when we need to start paying attention to the warning signs.
These right here are the big ones. The main signals your body sends out when your cardiovascular system is feeling the strain. And what's really important to get is that it's not always some big, dramatic, movie-style chest pain, right? It can be pressure or feeling out of breath, swelling in your legs, even just feeling dizzy. Every single one is a clue.
All right, this is a super important one because it clears up 2 things that get mixed up all the time. Think of angina as your body's check engine light. It's chest pain, yeah, but it usually pops up when you're exerting yourself and then goes away when you rest. A heart attack, well, that's a whole different ballgame. The engine is failing. The pain is way more severe. Resting doesn't help at all, and it usually brings along some terrifying friends like sweating, feeling sick, and this awful feeling that something terrible is about to happen.
So, you might be wondering who's most at risk here. Well, it's a mix of things. There's the stuff you can't really change, right? Your genetics, your family history, your age. But then there's a whole list of things that you do have some control over. And these are the big ones. Smoking, what you eat, how much you move, your stress levels. All of it plays a huge role.
You know when something like getting out of breath starts becoming a regular thing, doctors need a way to, well, to measure just how much it's affecting your life. So they use this scale, the NYHA classification. It's basically a way to stage heart failure. It goes from class 1, where you're pretty much fine with normal activity, all the way up to class 4, where you're having symptoms even when you're just sitting down. It's a pretty sobering look at how things can progress if left unchecked.
Okay, I absolutely love this analogy. Think of a failing heart like a secretary who is completely swamped with work. You can't just keep throwing more files in their in-tray, right? It's not going to help. The only answer is to take some of that work out of the in-tray. And that's exactly what treatments for heart failure try to do. They're all about reducing the load on the heart.
So let's say you go to the doctor with some of these symptoms. How in the world do they start to figure out what's going on? Well, it's like they open up a mechanic's toolkit. And the very first tool they reach for, it's always the most important one.
And get this, that first, most critical tool isn't some fancy high-tech scanner. It's a conversation. But don't get me wrong, it's not just a casual chat. When a doctor takes your history, it's a structured investigation. They're listening, really listening to your story, trying to pick out all the little clues.
And for something like pain, a lot of doctors use this really cool acronym, SOCRATES, to make sure they don't miss a thing. It's like a checklist. S is for sight, so where exactly is the pain? O is for onset. When did it start? C is for character. What does it actually feel like? Is it sharp, dull? R is for radiation. Does it seem to spread anywhere else? A is for associated symptoms. Is anything else happening at the same time? T is for time. How long does it stick around? E is for exacerbating or relieving factors. So what makes it worse? What makes it better? And finally, S for severity. On a scale of 1 to 10, how bad is it? See, every single answer is another crucial piece of the puzzle.
And it doesn't stop there. After Socrates, the investigation gets even wider. They'll ask about your past medical history, your drug history, and that means everything, prescribed, over-the-counter, whatever. Your family's health, even things like your job and stress levels.
because when it comes to your heart, it's all relevant.
So, what does all of this add up to? Well, it brings us to the most important point of all. Knowing all this stuff, the sounds, the symptoms, how doctors investigate them. It's like you're finally getting the owner's manual for your own body. And that old saying, knowledge is power, it's absolutely true here. As soon as you start to understand the language your heart is speaking, you stop being just a passenger along for the ride. You become an active, informed partner in your own health. You'll know when to pay attention, when to take it easy, and most importantly, when it's time to ask for help.
So, we've gone through the basics. We've decoded the language. The only question left is, what story is your heart trying to tell you?